Okay, so I'm going to be resubstantiating some of the claims made earlier. Madison tried to diminish my claim that there are external pressures on the patient to choose suicide. Well, I want to restate that it does become less of a choice because it's seen as necessary. Leonard Cass, as I mentioned earlier, stated that many elderly and incurable people will experience a right to choose death as their duty to do so, rather than a choice. I also want to show that, according to Ezekiel J. Emanuel from the Atlantic magazine, legalization of physician-assisted suicide would have a paradoxical effect in making patients seem to be responsible for their own suffering. Rather than victims of pain and suffering caused by disease, patients would be seen as having the power to end their suffering, and refusing that would mean that living through the pain was their decision and also their responsibility. So basically these patients are being blamed for their death. So what I'm trying to say is that the right to death is a burden in and of itself, and it justly puts the blame on the patient rather than the disease. Marilyn Golden also proves that cost is an important kind of pressure that causes patients to choose suicide. She says that a 1998 study from Georgetown University Center for Clinical Bioethics found a strong link between cost-cutting pressure on physicians and their willingness to prescribe lethal drugs to patients. Along with death, money concerns undermine the unalienable right to live. And if we make the right to live alienable, that kind of implies that, well, it implies that it can be taken away. Therefore, why do they need the permission of doctors to take away their lives? Why not just ask any person to give them a death-dealing drug or to shoot them, you know? Also, government and insurance companies may put undue pressure on doctors to avoid heroic measures or recommend the assisted suicide procedure. Health insurance providers are under tremendous pressure to keep premiums down, according to Joe Meserly of BalancePolitics.org. Rather than seeing these patients as people, they're more seen as a cost, because a lot of patients who are terminally ill don't have the health insurance to pay for their treatment. So that someone has to pay for it, and that goes on to the hospital. So there's a lot of cost concerns between the hospital and the patient, which goes to my next point, that the patient-doctor relationship is compromised. According to Robert P. George and William C. Porth, it diminishes the humanity of both patients and doctors, the former by treating their lives as disposable things, the latter by treating them as mere instruments to carry out the wishes of their patients. I also want to point out that negative result from PAS is that it'll eventually open up to those not terminally ill. Over the past 2 decades, according to Marilyn Golden, the Netherlands has moved from assisted suicide to euthanasia, from euthanasia for the terminally ill to euthanasia for the chronically ill, and so on and so forth. So this kind of chain from, at first, physician-assisted suicide in the Netherlands leading to euthanasia, if we take the example of the Dutch, well, we're probably going to end up in the same situation as well. Cassandra also claimed that there's people choose to commit suicide even though there's time left. Well, for those that want to stay alive, in 1991, in the Archives of Neurology, found that 58% of patients with a firm diagnosis of being in a persistent vegetative state recovered consciousness within 3 years. So if there's a chance of being a recovered individual, why not bank on the chance to survive? Thank you.